Hello, everybody in the Clinical Connections Facebook group. Hello to everybody watching on Instagram. Happy Thursday. Here we are again. It's Thursday. I want to welcome you all. Now you can see me. Thanks again for coming to another live stream. So today we're going to be talking about all things residency. We're going to be talking about kind of the things you want to think about before you do a residency, things to think about during the residency, and then things to think about after your residency. So if you're watching in the Facebook group, please drop your name. Tell me where you're watching from. If you're watching on Instagram, give me a little wave. Tell me where you're watching from. For those of you that don't know me by now, I am Dr. Jody Miller. I am a physical therapist in the Tampa area. I've worked in just about every setting. I've done outpatient in a hospital. I have done skilled nursing facility. I've been a rehab director. I've done home health. I've done pediatrics. I've done acute care, oncology. I have done travel physical therapy. I'm an adjunct professor, and I currently own a cash-based practice in the Tampa area, working mostly with gymnasts and cheerleaders. But I'm also the owner of Clinical Connections Mentoring, which is where you are now. So I want to thank you again for coming. Like I said, say hi, let me know who I'm talking to, and let's get started. So like I said, we're going to talk about everything that you might think about for residency. I'm not trying to sway you one way or the other. I'm just trying to give you just some options, some other things to think about, kind of pros and cons of a residency. So we're going to talk about, like I said, what you can think about before, during, and after doing a residency. So full disclosure, I chose not to do a residency because it wasn't best for me. I wanted to be a generalist. I did not want to specialize in any specific population or diagnosis. I still do not want to. Y'all, I need variety. I get bored very quickly. So I wanted to be able to always kind of treat everything from peds to orthopedic to neuro, sports, geriatrics, love amputees. I wanted that ability. I didn't want to get too specific into a specific population. I also wanted to be done with that constant schooling kind of feeling. I still definitely learn things. I've done continuing ed and all that stuff, but I was ready for a break from that constant due dates, expectations, requirements that kind of come with a residency. So this was the best path for me to not do a residency. And that's what I kind of want to help you do today, is figure out what's best for you. So how do you figure out what that is, right? So let's start with, first, you kind of need to decide whether you need a residency is for you or not, right? So you kind of want to ask yourself, why do you want to do the residency? Is it because you don't feel ready to be on your own? Is it because you truly want more help? Is it because you want to learn more? Is it because you want to specialize in something? Is it because you eventually want to get a certification, like a OCS or an SCS or a PCS, and you want to do it faster? Or is it because you just kind of want to boost your resume and you think maybe if I complete a residency, it'll look good on my resume, I may get offered more money, that type of thing. So you really want to figure out first, why do you want to do a residency? Kind of answer some of those questions, and that might help you kind of figure out which path you want to take. This is an individual decision, and there are a lot of factors to consider when you're choosing a residency. So there are a ton of differences between residencies. And like I said, I didn't do one, but I've heard a lot of stories. I've heard stories where in the residency, it is constant go, go, go. There's a lot of support. There's a lot of mentorship. There's a lot of education. And then I've heard others where it's each week it's, oh, read this article, and then we're going to talk about it as a group. And that's the extent of their residency. So you really need to do your research on the residency program, figure out the pros and cons of that specific residency. Okay. You also want to look at the size. So are you the only person doing that residency, or are there others in the cohort? Are there 2 people? Are there 5 people? So kind of figuring out the size of that residency will also help you determine the one that's best for you. Also look at cost or salary reduction. So most residencies will, you'll have a pay cut. So you'll be getting a salary, but it can range from 15, 20K less than what you would be making if you were just working on your own in that clinic, okay? You need to look at the time commitment. Generally, most residencies are going to require more than 40 hours of your time each week. So look at whatever that commitment is going to be, and is it what you want to do or not? You also want to look at the clinical site structure. So wherever you're doing your residency, is it always at the same site, or are you going to be bouncing between multiple sites? Is it a rotation type residency, or is there no, so like, are you going from, is it a residency in a hospital where you get to go to different floors? Or is it a residency in a hospital system that lets you do different settings? So like outpatient, acute care, inpatient rehab. So kind of looking at, is it a rotation-based residency, or are you staying in one place the whole time? You also want to consider, is it an academic-based residency, or is it clinical-based? So what that means is most of the focus going to be on clinical skills, or are you going to be expected to do some teaching? And do you want to do that? Okay, so these are more questions just to kind of ask yourself. You also do want to know what the mentorship within that residency looks like. So is the mentorship time blocked? So every Monday from 12 to 2, we're going to sit down with your mentor and you're going to go over things. Or is it just kind of sporadic whenever your mentor is available, right? So you can see if it's time blocked, you're probably going to be more guaranteed to have time with that mentor, versus if it's variable and it's just whenever you both have time, you may not get as much mentoring that you're looking for, if that's what you're looking for, right? Are the times for mentorship scheduled? So kind of the same thing. So how accessible is your mentor going to be? Is it planned? Is it scheduled? Or is it just whenever we can get to it, right? That's kind of a big factor. Most people want to do the residency for the mentorship, but you got to figure out what actually does that mentorship look like, okay? And then think about, does the residency meet your individual needs, or is it a general curriculum that's kind of designed for different types of people? Okay, I would say most residencies are going to be designed for they're going to have a general curriculum that you kind of go through versus meeting your individual needs. Okay, then you need to ask yourself, with all these questions, the answers to these questions, and whatever the residency has to offer, is it going to get you what you're looking for? So if you go back to all those questions that we asked at the beginning, why are you wanting to do the residency? Once you figure out all these different things about the residency, does it answer those questions? Does it get you what you're looking for? Okay. And then within the residency, can you get the results that you're looking for somewhere else? So you've answered all these questions, found out all the information about the residency, and then you need to say, step back and look and say, okay, can I get these results for what I'm looking for? Can I get it somewhere else? Do I have to do a residency to get what I want? And that can be like things just like studying on your own, right? Can you read all the books and read all the articles and get everything you want? Can you learn more that way? Or do you have to do a residency? You can look at, maybe if you are offered a job and it has a mentoring program, does that offer you the results that you're looking for? So can your job's mentoring program help you in what you want to do? Remember, go back to those first couple questions that we asked. And then the third option is always an outside mentoring program. So do those meet the needs that you're looking for? Okay, so it's a whole bunch of questions to ask in the before part of a residency. Okay, so if you choose to do a residency, there are a lot of things to think about within the residency, right? So some things to expect with the residency. You can expect that you're going to have increased hours, anywhere from 45 to 60 hours per week of work for about a year. So know that will be coming for you. With that comes an increased workload. So you're going to be studying, right? They're going to give you things to read and things to research. You may have possible teaching requirements depending on the residency that you choose. One, do you want to teach? Is that something you're interested in? But two, understand that will also be part of your hours for the week. So you may be required to be in the clinic for 40 hours, but you may also have to go teach for 5 hours a week, right? So, understanding that there's an increased demand in a residency. You may also be asked to do additional projects, research projects, designing programs, You have to present all of this stuff. So it's not just working in a clinic with a mentor, right? There's a lot of added things onto the residency. Okay. Some things you need to look out for in a residency, and I will say some of these are also things to look out for just working in a clinic, but specific to a residency, some external things that you can look out for is the expectations of the residency program. So just kind of all those things that I listed. Are they expecting you to do a whole bunch of stuff? These things you can't control. You are expected to do them as a member of the residency program. Increased demands, all of those things, more hours, more projects, more studying, maybe teaching, like all those demands, external factors, again, you can't change those things, okay? You're gonna have longer hours, up to 60 hours per week. Are you ready for all of that? And how are you gonna manage that, okay? You are going to have less free time in a residency. Granted, it's only a year, but you will have less free time, right? You just spent maybe 3-4 years at school, taking up a lot of your free time there doing studying. Kind of going to be the same story in a residency, right? So it's just an extension of more school. With that, you're going to still have that still in school mentality, right? Because you have things that you have to turn in, you have things that are due, there are things that are expected of you, versus if you have a job, you don't really have a lot of expectations like you would in a residency, okay? So you may not like all of the requirements of that residency, like teaching or research or doing other projects, but it doesn't really matter because in a residency, you don't have the ability to set boundaries for yourself because you have to meet these requirements, okay? So it's just something to think about when you're in the residency. So these, remember, you cannot change these things. They're expectations that you agreed to do when you join the residency. You cannot set boundaries around these things. You just kind of have to do them, okay? Now, there are some other internal things to look out for in a residency. So I would say the typical personality of someone who does join a residency is that kind of that go-getter. I want to learn everything that I can. I'm a straight A student. I'm going to do the best I can so I can be the best PT that I can be, right? Those are the type of people that go into residency. Nothing wrong with that. But with that comes a lot of internal factors that can play into how you experience that residency, okay? Number one, perfectionism. This type of person tends to be a perfectionist, right? I gotta get an A+ on every assignment. I have to get 100. If you have teaching assignments, I have to be the best teacher. I have to read all of the research articles and I really have to understand them. So there's a lot of perfectionism in this personality. But that's an internal thing. That is something that you can control, right? People pleasing, right? So you want to, if that is the type of person you are, do you want to please your mentors? Do you want to please everybody that's involved in the residency? Always saying yes to what they ask you to do, never saying no. So this is a place where, again, there are a lot of requirements, so you can't set boundaries, but this could be one little area where you can set some boundaries. So if you tend to kind of be that yes person, you're probably a people pleaser. So one way that you can manage a little bit some of that time during the residency is kind of pulling back, saying no when you can and when you're allowed to, okay? Imposter syndrome, another big thing that is an internal issue that you can control. Typically what I've seen is people that have imposter syndrome, they want to go into that residency as a way to learn more so that they can feel more confident and feel like they know what they're doing and not feel like an imposter when they are in the clinic working their own job, right? So this is, I'm going to say right now, that's not the answer. Doing a residency is not going to be the answer to solving any issues you may have with imposter syndrome, right? But it can be really easy for that imposter syndrome to creep up when you're on a residency, especially if there are other people in your cohort, right? So if there's maybe 1 or 3 of you all doing the residency at the same time, it's really easy to start comparing yourself to the other people in your cohort or even your mentor and say, oh, my mentor knew that right away, or Susie knew right away what the answer to that question was, and I couldn't even figure it out. Or she could help that patient way faster than I could. So see how imposter syndrome is really easy to kind of creep in, and comparison can really creep in on a residency. But again, it's internal. That is something you can control and something you can work on, okay? So that you can better manage your time and your experience on that residency, okay? Um, do you have, so another thing to kind of think about when you're in a residency is, do you have the ability to speak up if you feel like you need more support? Do you have the confidence to do this, to step up to your mentor and say, hey, I am just not getting this, or this patient is a real challenge for me and I need more support? Do you have that ability, or are you one that kind of tends to stay back and say, oh, I just have to figure it out myself, right? Remember, a residency is designed to teach you more, give you support. So if you can't ask for that support, residency might be a little bit more of a struggle for you, okay? What can you do if you aren't getting the mentorship or the guidance that you want within a residency, right? So kind of think about that stuff. If you don't feel like you're getting the mentorship that you want, let's say it's your mentorship in that program is the kind of the sporadic time versus the block time. If that's not meeting your needs, do you have that ability to step up and say, hey, I'm not getting that mentorship that I want, that I thought I was going to get in this residency program? How can we fix that? Right? That's something that you can take yourself, take control of that and make the changes there. If you don't make those changes and not meeting your needs, the residency is going to be harder for you. Okay. Um, so then you want to start kind of asking yourself, of all of these things, how can I manage them? Knowing if I'm this type of person going into a residency, I'm a perfectionist. I have a little bit of that imposter syndrome. It's really hard for me to say no to people. If that's you, how can you manage those things, right? Do you have a plan set up to start to manage those things if they start creeping in during your residency? Okay. Do you have any social support outside of the residency? Do you have, a spouse that can help you? Do you have good friends that you can meet up with in your little bit of free time, right? So if you don't really have a lot of social support out of the residency, you could see that the path you go down might just be everything residency, which is going to really lead to some burnout. Okay. A lot of overwhelm, a lot of fatigue. Okay. Um, Within the residency, do you have a way to kind of decompress? It's a lot, right? I said 45 to 60 hours plus a whole bunch of other stuff on top of working 40 hours in a clinic. Do you have a way to decompress from that? Do you have some self-care time? Can you step away from that and give yourself time to yourself to kind of recover each week? Um, think about, how do you normally respond to situations that are high demand, high expectations, a lot of work, right? How do you normally respond in stressful situations, or in situations where you kind of see that you're being that people pleaser or the perfectionist? What do you normally do there? And will you be able to apply those skills to yourself during that residency? I will say burnout is a big risk with a residency, especially if you go directly from school into a residency, right? You didn't really give yourself a break. That burnout that you kind of felt in school, and I know everybody has felt it, but that burnout that you felt in school is just going to continue into that residency because the demands are higher, right? All those things we talked about, they're higher. And then you have less control of the situation because of all the requirements and the expectations that are asked of you in order to complete the residency. So just understand that the risk for burnout is much higher in a residency because of all of those things. Again, I'm not telling you not to do a residency because you're going to burn out. That is not true for everybody. There are plenty of people who know how to manage these things and how to figure them out and how to deal with them, that they can get through a residency without burnout. Just know that it's a risk, okay? And it's an even higher risk if you don't know how to manage some of these internal issues like perfectionism, the people pleasing, and the imposter syndrome, and not being able to ask for support, the comparison. If you don't know how to control those or manage those, you're probably at a higher risk for burnout within a residency. Okay. So let's talk about kind of things to think about after your residency. Okay. So and this is one thing that I think a lot of people kind of don't think about until after the residency is over, but you're likely to lose that mentorship that you had during the residency, right? Your residency mentors are going to be less accessible to you now because they now have new residents to work with. They're not going to be there for you anymore. Okay. And then So think about, what are you going to do there? Are you prepared for that, right? Then you want to kind of think about, ask yourself, did this residency meet my needs? If you were looking for more knowledge, do you have that now? If you were looking for more confidence, do you have that now? If you were looking to get rid of that imposter syndrome, did that happen? Okay. So you kind of want to ask yourself some of those questions. Did this residency meet my need? Or am I still looking for some support in these things? Right. So sometimes what can happen, is a residency kind of becomes an extension of your clinicals, right? So you had your clinicals and you went to a residency. So you still had someone that you could go to for support and some guidance. You still had someone that you could lean on. You still had someone telling you, kind of got like guiding you, like, maybe try this with this patient. They told you what articles to read, what research to do, kind of told you what to think about. Think about this in the clinic, your clinical reasoning. They were there. They may or may not have been telling you how to treat specific things, right? So it's an extension of a clinical, but when that residency ends, that all goes away, right? All of a sudden, you're on your own. All of the decisions now are truly yours, because now you're really your own clinician, right? Without the support of a mentor in a residency program. So after that residency, you really want to think about, how do you feel now, right? If you're still seeking some of that guidance and the support, what kind are you looking for? Why are you looking for more guidance and support? How do you want more guidance and support? So if the residency met your needs, it's great. You're probably feeling better. But if it didn't, for whatever reason, you need to stop a minute and think, what other kind of support? How do I want support? Where do I want support? How do I want this support to look like? Okay. So ask yourself these questions and then figure out how to move forward from the residency, right? But please know that continued mentorship can still be available to you outside of your residency. Just because you finished your residency doesn't mean that you don't need to get mentoring anymore. It's always available to you, right? Whether it's at your job or as an outside mentoring program. Most, I will say, most mentoring programs compared to residencies are going to be more specific to what you need. Okay. So there are mentoring programs that are very kind of umbrella, all encompassing, but there are others that are more individual mentoring programs where you and your mentor can address your specific needs. And if you didn't get those needs met in your residency, it doesn't mean you don't get that option anymore. It's always there, right? A good mentor is going to guide you and coach you kind of alongside you to help you meet your needs. They're not going to tell you, go read this article now or do this with that patient. It's more of a support and guidance work, walking alongside you, not telling you exactly what to do like your professors did. Okay. When you finish that residency, you also want to think about, how can I dig deeper into what exactly I want to improve on? And if you still didn't meet those needs in your residency, or you want to dig even deeper, again, that's where maybe an individual mentoring program, whether it's at your job or it's an outside program, that is where you can dig deeper and really, really get to the specific needs that you have. Okay. So, like I said, just because you've completed a residency, it doesn't mean that you don't deserve any more support or guidance or mentorship, right? I've been a clinician for over 15 years. I still have people that I go to. I still have a coach that I go to who helps me with certain things, right? Just because you've done a residency doesn't mean that you're done with your support and your guidance. If you still want it, you can get it. They are still accessible to you if you still feel like you want that or you need that. Okay. I have a mentoring program. It's the Complete Clinician Program, and I address kind of all of these things, right? I help you gain confidence in your clinical skills. I guide you. We work a lot on communication skills so that you can advocate for yourself. So, kind of all those things that we're talking about: imposter syndrome, perfectionism, people pleasing. Got a ton of stuff on that so that you can learn how to advocate for yourself, ask for what you need as a clinician, learn how to communicate with your coworkers in difficult situations, maybe your boss, difficult patients, difficult family members, a whole bunch of stuff on communication that is specific to you, right? I work on helping you strengthen your clinical reasonings where you can tackle those really complex patients a lot easier. you can know what to do when you're struggling with patients. I can help you figure out how to be able to solve patient problems much faster. And I really help to help you elevate your treatment sessions where your patients are just raving about you. They want to refer everybody to you. You don't have to struggle with intervention ideas. You boost your creativity. Patients can't wait to see you for that next session. So that's a lot of what I do in my specific program. If it's something that you're looking for, whether you're thinking about doing a residency or not, this is also an option for you, right? If it's something that you're looking for, even after you've completed a residency, reach out, send me a DM, let's chat. So like I said, I'm not trying to push you one way or another into a residency or not. I just want you to kind of think about some of these things. Think about all those things before. Why do you want to do a residency? Think about those things during. Um, and do you have that type of personality that's going to get overwhelmed and frustrated and maybe burn out during the residency? And then think about some of those things kind of after the residency. Just because you're done doesn't mean you have to stop learning and getting support guidance. There are other options out there. I have one option for you. So if you want more information on my program, feel free to send me a message and let's talk about it. I hope you learned something today. Please share your aha moment in the comments. What's something that you learned today that you didn't know before? As always, if you have any questions or comments, feel free to drop them in the comments or send me a message. And I hope you have a great day, and I'll see you next time.